Welcome. You're listening to the Leading Health Podcast by the Kansas Health Foundation. We have a bold vision to make Kansas the healthiest state in the nation. And it's not just a vision, it's a movement powered by people like you. You are one of the 30,000 Kansans invited to help us shift our state's future. We're your hosts, Ed O'Malley and Susan Kang.
In each episode, we move beyond the usual conversation about health, the doctors and deductibles. Instead, we talk about capital H health, our ability to thrive. This is your invitation to grab the Leading Health book and join the conversation as we work together to make Kansas the healthiest state in the nation.
All right, welcome to episode 2 of the Leading Health Podcast. Susan?
Excited to be here.
Here we are.
Yeah.
Episode 2, which is covering chapter 2 of the book, Leading Health. The subtitle is How You and 30,000 Kansans Help Communities Thrive. So last episode, we talked about chapter 1. Mm-hmm. And in chapter 1, we talked a lot about that simulation experience that I participated in at the University of Kansas Health System, which was an amazing experience. Yep. And I start chapter 2 just picking up on that experience. Because one of the things that I learned in that experience is that the number of stroke victims up and to the right, like increasing year by year.
Yeah.
The number of trauma room visits, ER visits, up and to the right. The number of cancer diagnoses, up and to the right. So we start chapter 2 with this. I walked away from that hospital simulation experience with a provocative interpretation. The up and to the right data is what happens when we, the 30,000, fail to effectively exercise leadership on capital H health. Our brilliant medical professionals are the experts needed to deliver phenomenal health care, but it's the 30,000 movers and shakers of Kansas who have outsized influence on the things that create the condition for capital H health. Mm-hmm. It was a really interesting drive home that day, right? Mm-hmm. And I think it was driving home that day that I really started to think about what's the role of the 30,000? And that's what this chapter really talks about, right?
Right. Yeah. So say more about the 30,000.
All right. So what we're going to talk about here is that the 30,000 is a special group of Kansans, okay? They're a group of Kansans who hold authority in our state. And I got to that number 30,000 in the way you do all of the greatest things in life on the back of a napkin at a bar, okay? And I was trying to add up how many Kansans hold a role of civic authority. Like how many elected officials, how many pastors, how many nonprofit executives, community-minded business people, university deans, school superintendents. Long story short, it added up to about 30,000. Mm-hmm. Mm-hmm. And what we say in the book is that these 30,000 are a special group of Kansans. Members of this group have key authority roles, giving them the ability to focus attention, direct budgets, and cast vision. Simply put, when that group exercises leadership, they can make things happen. Now, we'll explore in the book that it's not just up to them to improve health, but they've got a special role to play. And that's what this chapter really talks about. It also talks about the health gap. It talks about the difference between the health of people like the 30,000
right,
and what we call the ALICE population. ALICE stands for asset limited, income constrained. It's the working poor, right?
Right.
Yeah. Brought to us by the United Way. They've been pushing this idea of ALICE, helping people understand the ALICE population. We'll talk more about that with our guest here in just a little while. But the chapter juxtaposes the health of the 30,000 with the health of the working poor and helps understand the influence the 30,000 has on the ALICE population. So we're going to get into that conversation with our guest here in just a little bit, and it's going to be a great conversation. I'm excited to explore it.
Yeah, me too. I'm really excited about learning more about the ALICE population, and I have an acronym that actually makes sense, the asset limited, income constrained, employed,
Yeah.
right? They're working and yet they're not making ends meet.
Yeah, and what the chapter's really trying to hit home too is that, look, if the playing field is level, then everybody's health is kind of up to them.
Yeah.
But if the playing field is out of whack, then we have a responsibility to level the playing field. And the playing field is created, in essence, by the 30,000. Right. All right. So that's the conversation we're going to have. It's going to be a great one. And Teresa Lovelady will be joining us here in just a little while for a fantastic conversation.
Yeah.
So it is awesome having Teresa Lovelady with us. Teresa, you and I have known each other a long time. You're president and CEO of HealthCore, which is a federally qualified health center here in Wichita, Kansas. You're involved statewide, though, as well. You're on the board of the Sunflower Health Foundation, which, of course, is a great partner of ours. We love our relationship with you, with all the work we've done together. What else should people know about you before we dive into this conversation?
Oh, man. I guess the most critical part is that I'm a compassionate and passionate resident of Kansas that love, and I am inspired by the work that you're doing right now to make certain that no Kansan is left behind. At HealthCore Clinic, I actually started out there as an uninsured patient. So I represent the Alice's across our state.
Wow.
I completely understand what it feels like to try to navigate a health, little h, and the big H systems that we have. When I first showed up at HealthCore Clinic as a patient, I came with my 4-year-old. He was starting kindergarten, and I needed an asthma action plan for him. I didn't even know that he had asthma. As he was growing up, I just thought he had Kansas allergies.
Yeah.
So I'm looking for a place to take him to gain access to care as an uninsured mom. And I will never forget not being mommy shamed when I showed up as Alice at the front desk of HealthCore Clinic. And so that was, my son's now 23, 24. He'll be 24 years old in a few weeks. And so it's been 20 years since that interaction there at HealthCore Clinic. And from there, as I continued my education and just transitioning in life, I served as a board member, so a consumer board member, so that I could, be a part of something that was amazing for, they didn't mommy shame me. If you think about that, how critical that is. And then from there, I became the CEO. I call it getting in the hot seat in 2010. And for the first 4 months, there was no money to pay me. And so if you think about the nonprofit world and sometimes what we struggle with and what we go through. And so fast forward 15 years, when I think about the work that HealthCore Clinic does in our community, each year we serve about 13,000 individuals, regardless of their income status, their income level and or their insurance status. So thank you so much. I am inspired to be considered one of the 30,000, and yet I understand completely what it feels like to come from a place in space and look at this situation from multiple sides.
Teresa, you definitely are one of the 30,000, and you're one of the 30,000 who can relate pretty darn well to life when you're not one of the 30,000. And I know we've got some questions. Susan, you got some questions that you want to ask, but I want to add a question real quick.
Yes.
I love that you said twice that you weren't mommy shamed. And I just think that it would be useful for people listening to this to understand what that means. Because there might be people who unintentionally have mommy shamed, right? Like I might have done that. But I think you're speaking to something that's really important. And I'd love you just to flesh that out a little bit. What does that mean exactly?
Okay. So when I showed up at the front desk, I had a job. It was a full-time job, but I earned about $12.50 an hour. And I couldn't afford health insurance. This is before the Affordable Care Act. And so my job did offer insurance, but was I going to pay the $500-$600 a month in premium for family health insurance, or was I going to pay the rent and buy food and pay child care expenses? And so I didn't get any subsidies, so I didn't get any food assistance, cash assistance in that way. And I was a full-time student also, working on my master's in social work.
Wow.
Because I wanted to have a role and position in society that could help give back. Because where I'm from, mental health and substance abuse and use where it was prevalent. So this was my way of giving back. But I could not afford basic health insurance to gain access to care. So when I showed up at HealthCore, I had $100 in my pocket. I'll never forget, $100, and I didn't know what to expect.
Yeah.
And when I showed up, they told me about a program that they had called Smart Start, which allowed my son to get a free health screening, health appointment. They served us. They went in the back, and I couldn't believe I got to keep the $100 in my pocket. And I didn't even know if that was enough. Like, how do you navigate a healthcare system? And when you have insurance, you don't even know what you're going to have to pay. So when you don't have insurance. And so my son, he's standing there with me. And the fact that they didn't embarrass me in the process or make me jump through hoops that would judge me at that moment as a parent trying to navigate a system to get an asthma action plan so my son could go to kindergarten.
Yeah.
But now they did give me about 4 prescriptions, Advair, albuterol, some really expensive cough syrup, and a spacer. So I went to Walgreens and I couldn't afford to get the medication. And so they went a step further. They gave me a spacer. They told me different different cough syrup that I could get. But most importantly, they signed me up for an asthma education class that I was able to come back. So this is upstream work, come back into the clinic and learn how to help manage my son's asthma. And I was able to bring my son and his big sister, who, of course, if you're a single mom with kids, you work as a family together to take care of each other. Right. What was impactful about that is later I caught my son, he's in kindergarten now, and he's telling his friend, if I breathe like this, tell your mom I need help. But if I'm breathing like this, and he made the sound, he was like, I just need to rest for a moment. And
I love that.
Gosh.
It's impactful and powerful when we provide access to a healthcare system and health, the big H. I love the concept about big H, without judgment.
Well, I love that idea. Like, it got easier to get the help you needed, the health for your son, because there was no judgment, because it sounded like the people at HealthCore, when you came there, already understood some of the things we're saying in this book, already understood that, somebody in the Alice population working hard might need a little help in order, just like we all end up needing help, right? But I love it. It's such a great way of thinking about it.
Well, when you think about health without judgment, I think about Mr. Bud Gates and Ms. Arnitha Martin, the co-founders of what initially started as the Center for Health and Wellness. They're on 21st and Erie. And so 3 blocks where the Shockers win and play, and and I think about the seed they planted in that community because of the health disparities that was there. The high incidences of suicide, cancer rates, the infant mortality rates. And so they came together and created what is now HealthCore Clinic that centers on education and wellness. So if we don't do that upstream work, and if we don't focus on how do we help individuals, how do we empower individuals to manage their own health, and how do we give them the tools and the resources and the materials, along with, sometimes we may feel like that handout. So you can't just give people a handout, you have to give them a hand up. So as someone who represents Alice, in that way, I think about where that hand up has taken me today to being the president and CEO of HealthCore Clinic.
Susan, I know you got a question you want to get in here, but I just want to give some context to our listeners. If you're not from Wichita, so HealthCore is located in the northeast part of the community. It is one of the communities in Kansas that faces the greatest health disparities. So it's a lot of challenges, people experiencing a lot of capital H and lower H health challenges. And the 2 founders of HealthCore you just mentioned, I think it's really a great example of, like, they, in their time, they were members of the 30,000.
Yes.
And I can imagine them thinking to themselves, what can we do to be helpful in improving health in the state? And so it's just a great example of what members of the 30,000 can do. And I just wanted folks around the state to have that context of the community that we're talking about right now. But Susan, I'm curious, what's on your mind right now?
Well, first I want to say, Teresa, thank you for sharing that story. It's just, it really resonates with a lot of people, I'm sure. And, and other people have been in that situation, especially with respect to the mommy shaming concept. But you've experienced it. You were a member of the Alice population, and you've had this journey of now leading, right? Starting there and leading the HealthCore, the organization, right? That helped you in the first place.
Yes.
Which is like, it's just it's poetic in some ways, right?
It's a privilege. It's truly a privilege.
100%. What a privilege. And so In your work now, I mean, what does that gap look like?
Oh my goodness. So again, when you look at from all the different perspectives, right, from that individual, that uninsured at the front
Yeah.
desk, when you think about it as a board member, because I also served on our board for a while. And when I think about the hot seat, when it's like, it's your problem.
Yeah.
It's your problem. And then I feel like you take on the weight of what can you do and how can you fill in that gap or at least build a bridge across the gap or just do something with the gap besides ignoring the gap. That becomes, it's really hard work because you do have all the conflicting things in the everyday work. I can't ignore the person who comes into the front door of the clinic and they need health care, like they need dental, behavior health, substance abuse, they need a hug. They need something right then and there. And then I think about the bigger overarching health, the systems in our society that drive those factors that physically make our communities sick, and then how do you impact, and as a leader, how do you do things in that area that help remove some of the barriers or like I said, fill in the gap without being, it's risky, right? Without being penalized, without being targeted, without being shamed, without burning out in the process, to be honest. So when I think about the 30,000 that have to do this work, we have to humble ourselves. We have to collaborate. We have to look internally at our respective organizations, but then also look at the other places where the 30,000 touch. So when I was listening to you talk about the back of the napkin and going through, I think about how I'm involved on different organizations, boards, and the foundations, and in the church and in the community, and even in my home at my kitchen table. So what are the things that I can do to help close the health gap in my family, in my neighborhood, in my community, at the clinic, and all the other places and spaces that I show up as a leader, so-called leader, right? So how do we lead in those spaces, and how do we exercise leadership in a way that we can impact the things to help close the gap?
Teresa, what is it that you think the 30,000 need to know? And, the chapter, the whole darn book, right, is kind of interesting in the fact that it's written for a very niche audience.
Yes.
It's written for the 30,000. And it's, in essence, making an argument, right? It's a little bit more in the style of an old-time pamphlet, where it's like, the pamphleteers at the beginning of our country would publish a pamphlet, and the pamphlet was an argument designed for a small group of people to read and absorb and consider and perhaps buy into, or maybe not. That's kind of what this book is. And it's aimed at those 30,000. And you're in such a unique position because you are one of the 30,000, but you have vivid lived experience of what it's like to
I am
not be.
Alice. I
Yeah.
will always be Alice.
Yeah.
But I can also be part of the 30,000.
Yeah.
So having dual citizenship.
Yes, you have dual
Yes.
citizenship. I love that.
Yes,
in
I love
both
that.
areas, and
Yes.
it's okay.
Yeah.
So,
Yeah.
So when I show up in certain areas or in spaces or boardrooms or back rooms or the front door of the clinic, I feel like I'm able to have a really unique resource toolkit when I show up in those spaces, whether it's in the boardroom and going, whoa, wait a minute, have we thought about involving individuals who have experienced homelessness
Yeah.
at this table, where whose voices are missing,
Yeah.
and then sometimes being able to connect to individuals that are board members, or I would say the more elite in our community, where it's like, no, but let me talk to you about this because I have a relationship with them and I can help them understand that it's okay to think that way, but let me tell you a different perspective.
Yeah.
And a lot of times when I share the Alice story, right, it's like, wow, okay, well, we're all capable of being Alice at any given moment. So one diagnosis, one lost opportunity, you lose your job. I mean, if you are in that situation, how do you navigate that? So when I think about what I would share with the 30,000 who probably represent multiple parts of that 30,000 because they have different roles in our community, is let's not forget that Alice is our neighbor. Not only is Alice our neighbor, she's probably a member of our family. She's probably definitely a coworker or a coworker's member, family member. Alice is, we cannot shame and blame. So when we make decisions and when we do things that can improve the health of our community and the health, big H, of our state, we have to remember that we're all deserving. So when we start looking at the deserving and undeserving in our community, we can't do that based on those thoughts of they deserve to be poor because they didn't do whatever, or they should have picked yourselves up by the bootstraps. It's like if you don't have boots,
Right.
if you don't have shoes, how do you do that?
I've always thought, look, can we agree if somebody is, all they're doing is just sitting on the couch, doing nothing, being lazy, not trying to make a better life for themselves or their family, let's agree. I still might have some compassion for that person, but I'm not going to tell the 30,000 that you have to make that person's life better. But the people who are working hard, the people who are trying, the folks who have just been dealt a different hand than some of us, if they're trying to play that hand to the best of their ability, part of what Chapter 2 is about is the outcomes they're getting aren't just on their backs. It's also on the backs of the 30,000 who create so many of the systems and structures and processes. And the way we put it in the book, real quick, is, are the 30,000 responsible for the situation our Alice friends are facing? No, not wholly, but yes, partly. We, the 30,000, create conditions that influence how and if Alice families can thrive, flourish, and be healthy. So it's we just want people to own that, we got a piece of it.
Yes. And if we can humble ourselves as the 30,000 and realize that we're all connected no matter what, the authentic connections that we have as human beings. I mean, COVID taught us that. If we were breathing on each other and you can then get what I have and I could make you sick, well, we could make each other sick if we don't take care of each other. And as a matter of fact, that's why our state is in the status where it is now, because ignoring the impact that we can have on each other's lives, even what we would consider the lazy person who's not engaged in society, well, they'll self-select and eliminate, but we cannot take one person or one example of a group of people and say we're not going to take care of the whole. That's kind of like if you had cancer in your body, you're not going to, you get what I'm saying? You got to take care of the whole so you can take care of our entire community in that way. So it's important that if you are blessed to be a member of the 30,000, that you take that blessing and understand that with that comes responsibility and the need to make certain that we give back in a way. And the easiest thing that we could do to give back as one of the 30,000 is to listen, be an active participant, non-judgmental, and in our little scope of influence, what are the little things we could do to help improve the health of our community?
So we're gonna. The book is gonna end up talking about a lot of different things we need the 30,000 to do, but let's just try to make it real concrete for some of our listeners right now. Of what are the ways? So what we're in essence saying in this chapter is, hey, the 30,000, you are partly responsible for the health outcomes of the entire state, right? How does that play out? I can imagine somebody in the 30,000 right now wondering well, okay, I kind of get it, but tell me something more specific of how my action
So as a member of as a dual citizen of the 30,000 and the Alice population, right? So what are some things that come up for you as you think about specifics that you might recommend?
At HealthCore Clinic, of course, being a community health center that provides access to medical, dental, behavioral health services, as well as we have a pharmacy embedded in the clinic. But we also have a food pantry. We have a walking path around the clinic. We have multiple education classes. We provide baby talk. So if you're around prenatal education to help someone be a healthier mom in hopes to make the child healthier and have the family healthy. So it's the little things we could do and embed It's the decisions that we can make for health insurance for our employees to make certain that it's a robust plan. It's really just asking someone how they're doing. It's the really small things. It gets really complex when we think about, oh my goodness, I have this huge responsibility to cure something that there is no cure to. But the little things that each one of us could do, what is it, like death by 1,000 little
Paper
cuts or paper cuts or something? So imagine revitalizing our state and our communities by the little bitty acts of things that we can do from our respective roles.
Yeah. In the book we write, the principal or manager, like the school principal or manager trying to get to the bottom of absenteeism is working on capital H health.
Yes.
Like that's an issue with compliance, that's an issue with discipline. It's also an issue about health. Like, maybe there are reasons why that kid is always absent that connects to things perhaps like the transportation we have available in our community or the challenges that family is having. And for that principal to think of that as not just a discipline problem related to absenteeism, but to consider it might be something bigger. We also talk about, the elected official considering next year's budget is working on health.
Yes.
Elected officials, I've been one. We often have to cut budgets. I get it. And we often get to choose how to invest additional dollars in things too. And knowing the connection between budget cuts or budget investments and capital H health for the Alice population really matters. Or we say the nonprofit board member working to improve their organization's effectiveness is working on health. So there's a lot of connections. We're going to explore these connections throughout the book, which is going to be really interesting. And Teresa, I know you're going to be back with us a couple more times for future episodes. So thanks for being a part of this journey. I don't know if you know if you knew what you're getting yourself into, but we're glad you did.
This is the first time I've ever been a part of a podcast. This is the first podcast. I guess I'll watch it, but I've never watched a podcast before.
Yeah.
So I'm like a podcast virgin here, I guess. So. But no, I am definitely honored and humbled that you guys would even ask me to come and be a part of this. But more importantly, if we can do anything to inspire the 30,000 to help support the next 30,000 that's coming in as well.
I love that.
And help pass along the thought and concept that 15, 20 years from now, we will get to number one, but it's going to take all of us passing a torch, kind of like Miss Sarnita and Mr. Buck Gates passed the torch down to me. And I take that with there's a level of responsibility and accountability that comes with that, to be in a role or a position to exercise leadership, not just be that leader sitting there, but actually take on the tough stuff as well.
Yeah. Thank you for this amazing conversation. I'm curious to know, what is the one takeaway that you are taking away from this conversation today?
Well, being a part of the 30,000, it's my goal now to go recruit others. And to make certain that I'm creating the pathways to help them understand the importance of the influence that they could have as they exercise leadership to help close the health gap.
Thank you. Ed, your thoughts?
To me, the term mommy shaming is sticking with me. And I think it's just a great term. And I think nobody wants to think of themselves as somebody who would engage in mommy shaming, the way you described it, Teresa. But I think it's a really great example of that's probably happening more than we realize, and it's not helpful, and I'm going to be thinking about that for a long time.
I think for me, it's for the 30,000 who are in positions of authority to know that they are in that position and that they truly are uniquely qualified to, with their authority, use that to help close the health gap.
Thanks for listening today. Before we leave, there are a couple ways you can help. The first, visit kansashealth.org/leadinghealth to claim your copy of the book and join in the efforts as we work together to make Kansas the healthiest state in the nation. The second is to share this podcast with your network. Also, we'd love to hear from you. Drop a comment from whatever platform you use to get your podcast.